All right, good morning, everyone. We're going to get started. My name is Dana Slowinski, and I am co-owner of Family Recovery Centers. Thank you so much for joining us this morning. We are very excited to have Javon Garcia with us. First, I just want to take a minute to give an overview of Family Recovery Centers for those of you that are not familiar with us. We are an evening adolescent intensive outpatient program, and we have locations in Lake Bluff, Hoffman Estates, St. Charles, and we also this fall are opening a location in Yorkville. Two program components that I like to highlight are the family involvement. So we have parents involved 2 of the 4 evenings that the patients or kiddos are with us. So they're learning the skills right along with their child, and then they're also doing their own work. So we're really wrapping around the family system and diving into those dynamics within the family system. And then we also have a 24/7 on call. So we have the staff that is working with the patients and families available 24/7 for skills coaching, so that we're not just providing treatment when they're with us, but we're also really helping them in their own lives, own situations that they may be struggling with. We work with a wide range of adolescents. So adolescents struggling with, depression, anxiety, bipolar disorder, self-injury, substance use, disordered eating. And we take a DBT approach, and we also incorporate other modalities, art, yoga, experiential modalities. And that is us in a very quick nutshell. I'm happy to answer any other questions that you have. So feel free to email myself or Ryan. And with that, we are so excited to have Javon with us, Javon Garcia, LSW, and he is with Howard Brown Center. And I'll turn it over to you.
Hello, thank you so much. So it's so great to have you all here. I will be presenting on affirming care for the LGBTQ community, a training on cultural humility. I also want to make sure that I give a trigger warning that I will be talking about things related to homophobia, transphobia, violence, oppression, and discrimination. So if at any point you feel like you need to step away, please take care of yourself. I'm here to educate. I'm not here to traumatize anyone. So please, if you need to go take a breather, get some water, go to the bathroom, please take care of yourself. Also, I will be mostly taking questions at the end. So if you can, please wait till the end so we can go through all the questions together, and I will definitely make sure that there is time at the end. I also will be asking for people to engage. I don't want to talk at you for the whole time. So it would be really great if the moments where I do ask people to kind of process and think and share with the group, please kind of step up and try to engage, and because that'll make this training a lot more fruitful and a lot more enjoyable for everyone. So I use he, him, his pronouns. I am a licensed social worker, and I'm currently a therapist at Howard Brown Health. I have a master's in social work from Loyola and a bachelor's in gender, women, and sexuality studies from Grinnell College. And I've spent about the last 10 years focusing my work on intimate partner violence, mental health, sexual assault awareness, gender and sexuality, LGBTQ advocacy, and trauma work. So these are the main 4 objectives that I really want us to focus on and get a lot out of from this training. So gaining a stronger understanding of health disparities experienced by the LGBTQ community, having an understanding of cultural humility, and also the difference between cultural competency and cultural humility, and why I will be focusing on cultural humility. Participants will understand how addressing LGBTQ clients and patients from a place of cultural humility is what increases overall engagement and retention in care. And then also gain strategies on providing cultural humility in the care of LGBTQ clients and patients. So what are you gonna be able to do to make sure that your LGBT clients are feeling affirmed and safe in working with you or working with your agency? So these are some questions that I'm not having us answer them, but more so think about them, reflect on them throughout the training, kind of really hold on to these questions and really ponder them. So thinking about how would you incorporate cultural humility into your work? What does that look like for your work? And I think it's important to realize that you don't have to do patient-facing work to be a part of increasing cultural humility in your workplace. Whether you do policy work, whether you do administrative work, whether you work at the front desk, everyone has a part in bringing more cultural humility into the workplace and bringing more awareness around LGBTQ issues within the workplace. Everyone from the front door staff to the back office should be aware of cultural humility and aware of how we can better serve LGBTQ individuals. How do we bring attention to the importance of decolonizing our fields and agencies? So really thinking about how does our agencies or the work that we do, how are we centering whiteness? And how do we decolonize the way in which we do our work? How do we really think outside of the ways in which our society and our practices and our policies really center whiteness and center white heterosexual people? Thinking about erasure, and so there will be some examples that I will be addressing in the training where we talk about erasure of the LGBTQ community and more explicitly erasure of trans and non-binary people. So thinking about how does that impact the people you work with, your clients, their mental health and their physical health. So I wanted to give a little LGBTQ 101 just because I don't want to assume. I don't want to assume anyone's knowledge. And so I think it's always great to just give a little background about what I'm talking about. So most people know the acronym LGBTQ, sometimes LGBTQIA. So LGBTQ, lesbian, gay, bisexual, transgender, queer, I's, intersex, A is often asexual. So we look at this spectrum, and I think I really liked this image because it really shows that it is a spectrum. And so sometimes people are on different places in different spectrums. So I think it's important to remember that sexuality and gender is not the same thing. Gender is how you identify. Sexuality, sexual orientation is who you're attracted to. So it's important to understand that distinction of sexuality and gender. And when somebody says cis, CIS, or cisgender, that means that you identify with the gender that you were ascribed at birth. So I was born male and I still identify as male. And so I am a cisgender man. And so that's just the simplest way of explaining that. Intersex meaning that a person's anatomy or genitalia doesn't ascribe to the male or female binary. When it comes to gender identity, in the middle, we have transgender, genderqueer, two-spirited. Two-spirited is a Native American term. Genderqueer, gender non-binary, gender nonconforming are also other terms that you would maybe see in that mix. And then gender expression, so androgyny is more so in the middle, not ascribing to specifically feminine or masculine. And so it's important to remember that people can be all over the spectrum. Someone's gender identity may be identify as a trans woman, but their gender expression could be masculine. So it's important to remember that just by looking at someone, you cannot tell how someone identifies. That's why it's important to ask someone's pronouns if you're unsure. That's the best way to be respectful and engage that person if you're unsure and don't want to make a wrong assumption. And then sexual orientation. So attracted to women, attracted to men, attracted to all. So in the middle, we would see maybe pansexual. So I'm attracted to a person regardless of how they identify. Also, there's asexual. So I am not sexually attracted. I'm not interested in sex. But I can still be in a romantic relationship with someone, but not interested in sex. And so I think it's important to remember that there's bisexuality, there's pansexuality, there's asexuality, and there's so many other things. And so I think it's also important to remember that how people identify changes. And so when we work with people, I experienced this working in a youth center, working with young people. 1 week, a person identified as they, them, and then a different week, the person identified as she, her. And that is okay. People at any age, but especially young people, are changing and finding themselves and growing and developing and learning about themselves. And so respect however they identify. If 1 week they identified one way and another week they identify another way, that's okay. Respect it and move on. So I think it's also really important to get into, we're talking about LGBTQ cultural humility. And so obviously there's a reason why this is so important. It's because of the fact that LGBTQ people experience very, very much a lack of supportive quality healthcare, especially when we think about the intersections of queer people of color. There's experienced a high rates of abuse, rejection, discrimination in seeking healthcare and mental health care. And I work at Howard Brown Health, which is an LGBTQ health center. All of our medical and behavioral health services center LGBTQ people in the city of Chicago. But the places like Howard Brown are very rare. And I really love and appreciate working at Howard Brown because I am serving exactly the people that I want to be serving and helping and working with. But also, most cities don't have places like Howard Brown, especially rural communities don't have places like Howard Brown. So a majority of people who identify as LGBTQ don't have places like Howard Brown to go to. And so that is very scary, especially with the state of our country and all the different laws and bills and policies that are trying to be passed throughout this country to prevent quality mental health and healthcare for the LGBTQ community. So I think we can't talk about cultural humility without talking about why this is so important and why we need people who are social workers, who are psychologists, who are therapists, who are doctors. We need them doing this work. We need them understanding the health disparities that LGBTQ people face and why we need to be doing better across the board when it comes to healthcare and mental health care. So and this is focused on LGBTQ, so a trans population is in a different study. So they've experienced, 8% said that they experienced a doctor or other healthcare provider refuse to see them because of their actual or perceived sexual orientation. 6% said that a doctor or other healthcare provider refused to give them healthcare related to their actual or perceived sexual orientation. 9% said that a doctor or other healthcare provider used harsh or abusive language when treating them, and 7% said they experienced unwanted physical contact from a doctor or a healthcare provider. And so bringing it into mental health, so these statistics are from NAMI, the National Alliance of Mental Illness. So LGB, so lesbian, gay, bisexual youth, are more than twice as likely to report persistent feelings of sadness or hopelessness from their heterosexual peers. And so we know that bullying is already very pervasive in schools, especially in middle school and high school. So adding on top of that, identifying as LGBTQ and the amount of bullying that that person experiences is going to be so much more exacerbated by the fact of just their identity. And trans youth, and when we think about trans youth or trans people in general, the stats are going to always be way worse. The stats are always going to be significantly higher, just because in society, trans people experience far more violence. When we think about the rainbow, trans people experience the most violent abuse, and we see it in the headlines, in the news, especially when we think about trans women and trans women of color. The numbers get higher and higher and higher. And so trans youth face further disparities as they are twice as likely to experience depression, consider suicide, and attempt suicide compared to cisgender, lesbian, gay, bisexual, queer, and questioning youth. According to a 2013 survey, 40% of LGBT adults have experienced rejection from family member or a close friend. And rejection is the biggest reason why LGBT youth will end up homeless. And if there is at least just one person that shows that young LGBT person love and affection, the outcome is often 40% more likely to be different, and that young person not ending up on the streets. And then 2019 school climate survey showed that 86% of LGBTQ youth reported being harassed or assaulted at school, which obviously is going to significantly impact and worsen their mental health. And it's estimated that LGBTQ youth and young adults have 120% higher risk of experiencing homelessness, often the result of family rejection and discrimination based on sexual orientation or gender identity. So we know that LGBTQ youth are already a highly vulnerable population. So you add on family rejection, you add on homelessness, you add on bullying and violence in school. And these numbers are very scary. So these healthcare stats center trans people's experiences. And so we can see that the numbers are very increased, much more increased than compared to lesbian, gay, and bisexual individuals. So 29% said that a doctor or other healthcare provider refused to see them because of their actual or perceived gender identity. 12% said a doctor or other healthcare provider refused to give them healthcare related to their gender transition. 23% said a doctor or other healthcare provider intentionally misgendered them or used the wrong name. 21% said a doctor or other healthcare provider used harsh or abusive language when treating them. And 29% said that they experienced unwanted physical contact from a doctor or healthcare provider. And this is just very alarming because doctors take an oath to make sure that they are caring for all people, do no harm. And so this is really horrifying to see these numbers because doctors are supposed to be there to care for people, all people, regardless of their beliefs. All people deserve equal access to healthcare. So it's very alarming when you see these statistics because this should not be happening anywhere to anyone. And as I said, trans violence is extremely high. These come from the National Resource Center on Domestic Violence. And they in 2015, they did a survey specifically focusing on trans individuals. So again, it's important to always think about intersectionality. How are a person's intersecting identities coming into play and making up their lived experience? So in communities of color, these numbers are drastically higher. 53% of Black respondents were sexually assaulted in their lifetime, and 13% were sexually assaulted in the last year. 72% of respondents who have done sex work, 65% of respondents who have experienced homelessness, and 61% of respondents with disabilities report being sexually assaulted in their lifetime. So I think it's really important to bring COVID into the context of the LGBTQ community. COVID has really impacted all of our lives, and it's still sadly impacting our lives. It is not gone as much as we want it to be. It is not. And so COVID has drastically impacted the communities that were already marginalized and oppressed. The COVID has exacerbated all of that. So when we think back to March 2020, and we think about the first couple of weeks of COVID, we thought, okay, this is going to be 2, 3, 4 weeks, and then we'll move on, not knowing that this was going to drastically change our lives. So the LGBT community, people who experienced LGBT-related family rejection were 6 times more likely to experience depression and 8 times more likely to attempt suicide than LGBTQ young persons who reported low levels of family rejection. So thinking about COVID and how COVID made us very isolated, adding on top of if you had to go back into the closet or had to go back living with family that rejected you or was not caring or nurturing, what that did to that person's mental health. Family rejection of LGBTQ identity is often the top cited reason for homelessness among young LGBTQ people. So social and physical distancing measures to limit the spread of COVID-19 in the US have forced many LGBTQ young people into homes that were unsupportive, potentially unsafe, because of the fact that universities closed, K through 12 school closed, people had to move out of dorms and go back home. So all of this during COVID put LGBTQ people even at higher risk to being in environments that were abusive and toxic and dangerous and harmful. And the concealing of one's LGBTQ identity also negatively impacts your mental health because you're not allowed to be yourself. You're not allowed to live in your authentic self. Maybe you're at university, at college, you were able to be your full self and dress the way you want to dress. and fully engage in being and living in your truth. But during COVID, if people had to go back home and back into very unsafe environments, all of that had to be concealed and go back inside and not be out. LGBTQ young people who are not out to their families at home may struggle with the inability to live authentically in their day-to-day lives because they may fear being outed or potential consequences of physical abuse or homelessness. And then thinking about the physical closings of universities, schools, K through 12, young persons having a lack of access to affirming social support and coping resources. And some stats on LGBTQ adults in the pandemic. So 22% of LGBTQ adults and 24% of LGBTQ adults of color are currently unemployed due to the pandemic. And 31% of LGBTQ adults of color, 29% of bisexual adults, 43% of trans adults had their work hours reduced compared to 26% of LGBTQ adults, 24% of adults of color, 23% of white LGBTQ people, and 18% of the general population. So we can see the numbers and how among, again, intersectionality, when we think about the people who are on the margins of the margins of the margins, we look at trans women, trans people of color have experienced the most issues with high rates of unemployment and setbacks during COVID-19, which only exacerbates the current health disparities that LGBTQ people face. So I've been talking about intersectionality, and I want to define that for you because not everyone may know what intersectionality is, but it refers to the unique experiences that arise due to the interaction between race, gender, sexuality, disability, age, religion, many, many other factors, class, everything, and those intersections. And so Kimberly Crenshaw coined this term in 1989. She's an American lawyer, law professor, and critical race theory scholar. I'm sure in the last year, we've heard a lot in the news about critical race theory. Well, in 1989, she coined the term intersectionality to explain the oppression and discrimination she faced as a woman of color. And so she worked at a law firm in Los Angeles, and as a Black woman, she saw white women being promoted above her, and then she saw Black men being promoted above her. So she realized, okay, well, it's not because I'm Black, because a Black man got promoted. It's not because I'm a woman, because a white woman kept getting promoted. Well, oh, it's the intersections of being a Black woman that are making up this lived experience. And so a quote of hers, which I think is very impactful and very important, is if we aren't intersectional, some of us, the most vulnerable, are going to fall through the cracks. And that applies to everything. That applies to education, that applies to healthcare, mental health care, policy. If we are not being intersectional in the way in which we approach our everyday life, the work that we do, people are going to fall through the cracks. And the most marginalized of marginalized are not going to get the care and help that they need so much. And so I learned in this training that I went to, it was really good. It was like focus on somebody who's experiencing homelessness, focus on someone who is a woman, who is Black, who is trans, who is disabled, all of these different intersections, because we want to make sure that we are not missing something, because then we're able to catch all people when we think about intersectionality. Also, it's important to note that when you don't think about all of the person's intersecting identities, that you may miss something. Because if I'm just focusing, this client's coming to me with a problem, and I'm just focusing on their lived experience because of their race, their gender, and not and their class, maybe I'm missing they have a disability. And so that disability is not in the context of my thought processes. And so maybe I'm missing how that disability impacts their overall experiences as a queer person of color from a low income background. So again, really important to always be thinking about, how does intersectionality come into play? So what is cultural humility? So cultural humility is a lifelong process. It's a commitment to self-evaluation, self-critique, learning, reflection, and working in partnership with those belonging to a different culture. It is evident that in order to reduce health disparities in the LGBTQ community, attention must be paid to both the provider and patient education, provider-patient interaction, and organizational structures, processes, policies, and practices. So to break that down, we want to choose cultural humility instead of cultural competence. So for a while, everyone was using cultural competence, but we also recognize that the idea of cultural competence is this idea of, in the little word of competence, of like, I can have a whole understanding of someone's culture, and that is never the case. We can't ever have a full understanding of someone's culture, because also we're always learning. Culture is also often changing. So that means that we can educate ourselves, but that education doesn't stop. It's a lifelong process. And to truly be embracing cultural humility, that means that you're constantly self-evaluating yourself. You're constantly critiquing yourself. You're constantly learning, reflecting, and working on understanding different cultures and different perspectives and different lived experiences. And so we can never be confident in someone's culture. We can never be all-knowing. And it doesn't matter if you've been a social worker or a therapist for 60 years, you are not all-knowing. We are never all-knowing. We constantly have ways in which we can learn and improve and gain knowledge, and that's so important. And I think that it actually is dangerous when we get to a point in our career where we feel like we don't need to learn, because there's always things that we can learn and grow and improve upon. And if you become stifled in your learning, that is going to greatly impact how you see your work and how you work with clients, and your ability to be open to new perspectives and ideas and lived experiences. And when it comes to paying attention, attention must be paid to both provider and patient education. So provider and patient education, I'm thinking about trainings. I'm thinking about community trainings and how in which we share information and knowledge. Provider-patient interactions, I'm thinking about meetings, I'm thinking about sessions, I'm thinking about consults, all of those. And then also thinking about organizational structure. So the mission, the policies, the way in which we practice. So how are we engaging cultural humility in all of these different ways? Whether you work at an agency, whether you run an agency, whether you have a say in agency policy, it's really important to think about, how do I bring cultural humility into all of this? And leadership from healthcare organizations, healthcare education entities, and community-based organizations is critical in order to achieve health equity for this historically marginalized community. So I also want to bring up systemic oppression. I think that we can't really talk about the historical oppression and discrimination of the LGBTQ community without talking about systemic oppression and how this manifests. And I like to think of it, I was in social work school, so I like to think about it as PI, person and environment, thinking about micro, meso, and macro. So individual is like micro, institutional, meso, structural, macro. So an example that I used is an individual oppression, thinking about how a young person being kicked out of their family's house because they identify as LGBTQ. Institutionally, so a young person being fired from their job or expelled from their university because of their sexual identity, gender identity, which goes against the institution's religious affiliation. And so this is based off very true circumstances of someone I know who was expelled from their university because it was a Catholic university. And they came out on their Facebook, and the university found out, and the university questioned this person, and the person said, yes, I am gay. So the school, by the rules that are affiliated with the going to this Catholic institution, they had every right to expel this person from the university. So thinking about that, and also institutionally thinking about K through 12 schools, some schools are better than others, but thinking about how bullying and how sometimes bullying is not taken seriously, and the consequences of the person who is bullying others is not taken seriously. So who can this person turn to if these institutions have every right to do this? And because they're able to say, well, this is due to our religious affiliation, we are in the right. Who does that person turn to? Where can that person go for help or support? Structural, so thinking about the policies, the laws, thinking about how only recently there are certain states that have ended sodomy laws in certain states in the US, only recently. So structural, I'm looking at, because this is not abstract. There's plenty of this happening right now. Sadly, a lot of it is happening right now. So the passing of anti-trans bills in the United States. So a lot of these trans bills are targeting trans and non-binary people, barring them from any kind of sports teams with the gender they now identify with, barring them or criminalizing them for healthcare. So trans youth can't get hormones, barring access to use of appropriate facilities like restrooms, restricting trans students' ability to fully participate in school and sports, allowing religiously motivated discrimination, or making it more difficult for them to get identification documents with their name and gender. And so there's tons and tons of these bills. Thankfully, some of them have been struck down, but there are some states that are passing these anti-trans bills. And it's very scary. It's very harmful, and no good will come of this to anyone. And so when I think about systemic oppression, I think about also how it's kind of like this toxic cycle that just goes on and on and on and on. And it's kind of pushed by people seeing very false narratives being pushed in media and news about the LGBTQ community, about trans people, about non-binary people, then certain family members or parents or guardians believe this and perpetuate this. And then there are certain institutions, schools, universities, workplaces that then again, people in charge perpetuate this discrimination and stigma and oppression, and false narrative. And so it's just a constant cycle. And so unless we have someone coming in and breaking up this false narrative at some point, the cycle sadly just perpetuates. So I really loved this video from a professor at UC San Diego who's talking about LGBTQ health and inclusion. And I thought it really was a great sum up of the importance of cultural humility and why we strive for cultural humility over cultural competence.
My name is Dredge Kong, and I'm a professor at UCSD. The global health program at UCSD is housed in the anthropology department. And so I think that helps students a lot too with kind of how to think about health issues. Part of our perspective is always to understand the world from the perspective of the people that you're working with, right? So kind of the old adage of, walk a mile in other people's shoes. In the past, the term that was typically used was cultural competence. And cultural humility takes a different stance because cultural competence implies that you can know a culture and then be competent in it. And then you can deal with people, for example, from that cultural background. Whereas cultural humility emphasizes this idea that we're always learning culture, right? And cultures are always changing too. And everybody within a culture is not going to be the same. So just because somebody's Mexican or just because somebody's from Somalia doesn't mean that they're gonna have the same beliefs, have the same attitudes, have the same behaviors, or react to you in the same way based on, how you're coming to them based on what you know about their background. So cultural humility takes this stance of asking more questions, right, of the patient and not making the assumptions that people often do about the patient. For me, the baseline is human dignity. Treating everybody as if they had value in the world, whether other people think they do or not. The first job that I got where I was provided with healthcare, they automatically enroll you into an HMO and you just go to the doctor and see them. So the first appointment that I had with the doctor, I went. And during the first appointment where we're, doing our introductions and stuff, I told the doctor I'm gay. And he literally jumped back, right? And I was like, it made me feel so am I a monster or something, right? So a lot of people just fall out of care, right? They're just not gonna go back to the doctor again. And so that's where, issues of things like stigma and discrimination come up in terms of access, retention, and trust of the healthcare system. Medical schools have changed a lot in terms of how they're doing curricula and residency and things like that. And you would be, I think, hard-pressed now to find a medical school that doesn't do something around cultural competence, that doesn't do something around care for different populations. And I would say probably the majority of them now have something around LGBTQ issues. I think it's also a general cultural shift, right? So I didn't think that in my lifetime I would see same-sex marriage, right? And then that happened. Might not be around for that much longer, but it happened, right? So I think there are these huge cultural shifts in terms of social acceptance. And even if there's not social acceptance, there's social tolerance that's increased, right? So obviously there's still violence, obviously there's still bullying, obviously there's still a lot of kind of hate and discrimination, but I think social attitudes have changed a lot over the years to make it much more livable for LGBTQ people. I don't want to say it gets better because things always change, but it has gotten better, right? for a lot of people. And I think that's something that we can be proud of.
So I thought that was a really great video that kind of like sums up our discussion around cultural humility and the difference between cultural humility and cultural competence. Okay, so this was a video that has really gone viral in the last week, and I thought to put it in this training because it really connects with what we're talking about in thinking about words do matter, the thoughts and opinions that we have, the things that we say, the things that we put out there, it does matter, and it does have a consequence. And so when people say ignorant things, it is harmful because your words may not be in that moment like causing violence, but they do enact violence in the ways in which that thinking, the thinking of erasure of trans and non-binary people, perpetuates this idea that trans and non-binary people don't exist, they don't have healthcare needs or mental health care needs, that they are not important, that we should not be talking about them. And so this video really spoke to me because in the comments, it was interesting how a lot of people, the professor is a law professor at UC Berkeley, Professor Bridges, how a lot of people in the comments were attacking her, being like, wow, this woman is aggressive. This woman is being too much. But when we see the video, it's important that these words have consequences, and these consequences deeply, greatly impact the healthcare of trans and non-binary people. And so it does perpetuate violence, and it is harmful. And so I will talk more about it after we watch this little clip. So Senator Josh Hawley is a Republican senator in Missouri, and then Kiara Bridges is a professor, a law professor at UC Berkeley.
Before I want to visit with you, Ms. Maskey, but before I do, I just want to clear one thing up. Professor Bridges, you said several times, you've used a phrase, I want to make sure I understand what you mean by it. You've referred to people with a capacity for pregnancy. Would that be women?
Many women, cis women, have the capacity for pregnancy. Many cis women do not have the capacity for pregnancy. There are also trans men who are capable of pregnancy, as well as non-binary people who are capable of pregnancy.
So this isn't really a women's rights issue.
We can recognize that this impacts women while also recognizing that it impacts other groups. Those things are not mutually exclusive, Senator Hawley.
Oh, so your view is that the core of this right then is about what?
So I want to recognize that your line of questioning is transphobic, and it opens up trans people to violence by not recognizing that.
Wow, you're saying that I'm opening up people to violence by asking whether or not women are the folks who can have pregnancies?
So I want to note that 1 out of 5 transgender persons have attempted suicide. So I think it's important
because of my line of questioning? So we can't talk about it?
Because denying that trans people exist and pretending not to know that they exist.
I'm denying that trans people exist by asking you if you're talking about women having pregnancies?
Do you believe that men can get pregnant?
No, I don't think women can get
So
pregnant.
you are denying that trans people exist?
And that leads to violence? Is this how you run your classroom? Are students allowed to question you?
Absolutely.
Or are they also treated like this, where
No,
they're told that they're opening up people to violence?
We have a good time in my class. You should join.
Oh, I bet.
You might learn a lot.
Wow, I would learn a lot. I've learned a lot just in this exchange.
Absolutely.
Extraordinary. Before I want to visit with you, Ms.
So as we can see in that video, it's important to remember that words do have power, and that power has consequences. And so when people, whether it's consciously or unconsciously, erase the trans experience or non-binary experience, that does cause violence because of the fact that people are hearing this, people are taking this in. It perpetuates ignorance, it perpetuates discrimination, and that also comes into context when we think about healthcare and trans people having access to healthcare that is not oppressive or discriminatory. And so it's really important to think about how the way in which that conversation happened, also, there was just so much power happening in that conversation. And I was really taken aback by that clip when I saw it. And I think it's important to remember that there is a long-standing tradition of dehumanizing LGBTQ people, especially trans people. And I really liked this graph because this graph gives you a little bit of a better understanding of like the dehumanization of trans people begins with anti-trans stigma, hostile political climate, lack of family acceptance, cultural marginalization, invisibility, which is literally happening in that video as we speak. So that invisibility, that ignorance, leads to higher rates of risk factors. It reinforces stigma. It reinforces false narratives around trans people. And then that increases issues around poverty, homelessness, physical and mental health disparities, intimate partner violence. Again, this is a cycle, this is a pattern. If we're adding in racism, sexism, again, trans people of color, trans women of color experience the highest rates of violence. So again, we can see how all of these escalate violence, cause violence, perpetuate violence. So these are some examples of healthcare discrimination. Thinking about how the effects of the ignorance and the oppression and the marginalization and the outcomes of those things that trickle down into healthcare. So an example is one patient with HIV disclosed to a hospital that he had sex with other men, and the hospital staff refused to provide him his HIV medication. In another case, a trans teenager who was admitted to a hospital for suicidal ideation, self-inflicted injuries, was repeatedly misgendered, and then discharged early by hospital staff and later died by suicide. Also, discrimination affects LGBTQ parents. In Michigan, an infant was turned away from a pediatrician's office because she had same-sex parents, even though many states, such as Michigan, lack explicit statewide laws against LGBTQ discrimination. So these are even more effects of that trickle down, of that oppression and prejudice. So prejudice and discrimination have social and personal impacts. On the social level, prejudice and discrimination against LGBTQ people are reflected in everyday stereotypes of members of these groups. These stereotypes persist even though they are not supported by evidence. They're often used to excuse unequal treatment. For example, limitations on job opportunities, parenting, and relationship recognition are often justified by stereotypic assumptions about LGBTQ people. The widespread prejudice, discrimination, and violence to which LGBTQ people are often subjected to cause significant mental health concerns. Sexual prejudice, sexual discrimination, and anti-gay violence are major sources of stress for LGBTQ people. Although social support is crucial in coping with stress, anti-gay attitudes and discrimination make it difficult for LGBTQ people to find these supports. And so it's important to know that like Howard Brown Health, we focus on providing care for the LGBTQ people, but we are not the only ones. There are other practices that pride themselves on being aware and having LGBTQ inclusivity within their therapy practice and the way in which they provide mental health care. But because Howard Brown is so well known, we will have people waiting on a waiting list forever to see someone at Howard Brown because they know that this is specifically a health center that is focused on LGBTQ people. And just the name and the recognition of Howard Brown, people will seek out Howard Brown and wait to see a Howard Brown therapist just to have that security of knowing, okay, I'm at an LGBTQ health center. I know that this person should be more informed and aware and will respect me and call me by the name that I want to be called and by the pronouns that I want to use. And so there is not a lot of places like this. So this is a very real issue that I saw that is horrifying. It's around PrEP. PrEP is pre-exposure prophylaxis. It's a pill that you can take every day to prevent the infection of HIV, and is shown to be up to 99% effective if it's taken as prescribed, which is every day, 1 pill a day. So this lawyer, Jonathan Mitchell, he is a lawyer in Texas, and he was a lawyer on the Senate Bill 8, which is the bill that really promoted people in Texas telling on other people who were getting abortions or doctors that were providing abortions to clients. So he stated in the case of Kelly versus the United States of America, filed in federal court in 2020, Mitchell represents several clients who object to the Affordable Care Act's mandate that insurance providers cover, among other things, preventative medications such as PrEP. So PrEP, which has been around since 2012, 2013, is a very, very important pill for anyone, but especially people within the LGBTQ community. The PrEP mandate forces, and this is Jonathan Mitchell saying this, the PrEP mandate forces religious employers to provide coverage for drugs that facilitate and encourage homosexual behavior, prostitution, sexual promiscuity, and intravenous drug use. The lawsuit states it also compels religious employers and religious individuals who purchase health insurance to subsidize these behaviors as a condition of purchasing the health insurance. Regarding the plaintiff, the suit claims neither they nor any of their family members are engaged in behaviors that transmit HIV, which is interesting because HIV is not a gay disease. It's not only do gay people get it, and actually currently in the UK, this is the first time in the UK that rates of heterosexual people getting HIV are actually higher than gay men being diagnosed with HIV. So HIV does not discriminate, and this whole case is just based in discrimination and oppression and hate. And if this was to ever happen and go through, this would harm so many people, not just the LGBTQ community. So in taking all of what we've learned about about cultural humility, the LGBTQ community, thinking about how can we be better allies and stand up for the LGBTQ community? How can we bring cultural humility into the care that we provide for our clients and patients who are LGBTQ? This image by Michael Hogan, how personal competencies promote effective relationships with people of diverse cultures. So in the middle, it's showing how understanding, respect through dialogue, conflict recovery, and problem solving, all these different steps, 14 different steps surrounding how those can really effectively help us become more of checking in with ourselves. How are we checking in with people who are different from us? How are we engaging cultural humility? The 14 personal competencies from the chart. So number one is be non-judgmental. So we often have a common tendency to judge those we perceive as different. Also be flexible and adjust and readjust. So again, as I said earlier, people are constantly changing. That's okay. You having an issue with someone changing their name or pronoun is a you issue. And so it's important to remember to look inward. That is your job to readjust, not the client's. And then be resourceful, be prepared, look for alternatives. So again, doing your own research. Your client knows themselves and knows their life, and they're going to be able to give that to you. But when you should never use your client as your teacher. Like, they are not there to teach you. It's important that if you don't understand something, if you're confused, do that work on your own, because clients, especially LGBTQ clients, especially LGBTQ clients of color, already have so much that they're going through, and have experienced a lot. And so having a cisgender, straight, white person maybe asking them all these questions, that's going to be draining. That's not helpful for them. So it's important for you to do that work separately on your own. Pay attention to your personal perceptions, attitudes, beliefs. So be observing yourself and the way that your body feels. When you interact with certain people, how are you feeling in your body? Are you feeling uncomfortable? Are you feeling comfortable? Are you feeling tight? Are you feeling anxious? Why do you think you're feeling this way in your body? Talk about it with a supervisor, with a friend, with a coworker, but that is not the job of your client to figure that out with you or for you. Pay attention to your thoughts and feelings. As much as I can even speak for myself and say, like, as much as I try my hardest to not have a judgment, sometimes it happens and I have to deal with that myself. I remember doing a mental health assessment with a client who's a trans Black woman who needed a mental health assessment to recertify her gun license. And I felt very uncomfortable because guns make me very uncomfortable. But again, like, I am doing this thing for this client. It is not about me and my comfortability with guns. But internally, I was just like, why does this Black trans woman want a gun? And I was just like, what? And I, again, had to remember that, like, this is not about me. I'm here to help this person and be there for that person. And my stuff is my stuff, not for her to be concerned with. Remember to listen carefully, and really make sure that you're actively listening to your client. Observe attentively, really make sure that you're engaging. And again, this is not just for LGBTQ individuals, this is for anyone across the board, of how you can be more engaging and more empathetic and more supportive and more open-minded. open-minded and also open in general. So people are complex, and that's okay. Don't assume that by meeting a person one time that you know them and their experience and you know all of them, because oftentimes it takes multiple times of engaging with someone to really know all of them. And it's important to remember that people are like onions, like they really are. There's so many layers. So try really hard to not make assumptions about people in general, but especially in getting to know someone. Tolerate the stress of uncertainty of how will this person identify this week, or how will this person look this week. Again, be open to uncertainty. Just be open. Have patience. Again, manage your personal biases and stereotypes. Doing that work on your own time with a supervisor, with a supportive friend, with a supportive coworker. Do that work. Again, but on your own time. Keep a sense of humor. Show respect, show empathy. So if you accidentally mess up someone's pronouns, like, it's okay to be like, oh, I'm so sorry, I forgot, and just keep it moving. If you make it a whole thing, that can make that person feel really uncomfortable. So it's really important to not dwell in it. So this is when I would love to have some people in the audience share. So based on your own personal and professional experiences, respond to the following questions. So describe a scenario in which you or someone that you know experienced cultural humility thereof in an interpersonal exchange. Consider the cultural context in which this occurred. And then reflect on and evaluate your response. What types of actions or competencies reveal cultural humility to you? One way that I can recognize and develop cultural humility in myself is to blank. One time that I witnessed / experienced genuine cultural humility was, and cultural humility can directly benefit me, my colleagues, and clients because. So I like to give a minute or two to think about these questions, and then I would love for people to share. And if you can, you could use the raise my hand button, and that would be helpful. I'll give us about a minute to think more about these questions and process.
All right, John, we have two hands up. I'm gonna
Go ahead.
So Emily, I'm gonna allow you.
Hi, can you hear me okay?
Yes.
Awesome. So I'm Emily. I'm really happy to be here today. I think that, you know, when these reflection questions came up, something that I thought of was, you know, my own experience as someone of the LGBT community and how that informs my work, because I struggled with a lot of shame and fear of the lack of cultural humility in my environments and communities around me. And so it took me quite a long time to come out to even my family. And I think that knowing that it, you know, the different sorts of competencies that really reveal cultural humility to me is someone that's just willing to sit and listen and respect my story and not take my story and share it as if it was their own. because when I first came out, my sister then took my story and outed it to my family, other members that I hadn't shared. And that really made me shut down. And I think those experiences of my own have really helped inform me just how severely important this idea is, that we're really never done learning. And we owe it to, I owe it to myself, but also primarily my clients to continue that work. So I hope that answers some of these.
Yes, thank you.
Okay, I'm going to, let's see. All right, then we have Valerie.
Hi. Yeah, so I work in a residential facility with adolescent female girls. We have a large transgender community that comes in and out, depending on what our clients are dealing with. Yesterday, I had a family session with an LGBTQ resident who identifies as transgender. Dad doesn't always respect his preference, and we're trying to educate. So in the session, we are doing it via Zoom. I pulled up a site to kind of help explain more about transgender, give some feedback, give some definitions. And I felt like, okay, humility there. I could show that. I did struggle when the client said that he was a transgender femboy, and that's where I kind of stumbled and was not sure how to respond to that, because it was very confusing to me as he was trying to explain that. So like getting more information on how do I respond to that would be helpful, because I just wasn't sure, because when I looked up what that was, I wasn't familiar with the term femboy. Looked it up, said it was a male that dressed more female, wore dresses and stuff like that. And so then I was confused, and I said, help me understand how you are a transgender femboy. But I felt like I failed in that moment. I felt like had the humility and show, being able to let's look this up and share with Dad to try to help Dad educate, but that very much stumbled in that area. So yeah, difficult line to walk there.
Thank you so much for sharing that. I really appreciate you being vulnerable and sharing that. I mean, we always are trying, and that's all that you can do is try. And it definitely sounds like the difference between gender identity and gender expression, and that person's expression is more feminine, but their identity is male. And I mean, honestly, like a lot of this is new for some people who have never worked within gender and sexuality before, and or had to like work with young people around this. So I also think that as long as you're doing no harm, you're trying, it's really important to be kind to yourself as you're growing and learning and trying. And that's really important. Oh, anything else before we move on?
I don't see any other hands up right now. So
Okay, we can
oh
move
wait,
on.
there was one
Oh.
more. Hold on one second. I apologize if I say your name wrong. Aylin, I believe.
Hi, everyone. Thank you. It's Eileen. I'm so excited. I want to say hi, Javon. I'm so excited to see you.
Oh my gosh.
Yeah, I'm so excited, and I can't believe we are still in this same field and came across with this training in this mental health field. Yeah, firstly, I want to respond to the last point. The cultural humility definitely benefit me and my organization that I'm working with. So I haven't had any experience yet, but I know we will eventually. I'm so grateful and appreciate this information that you shared. I want to say that with the LGBTQ community, we it's very important for us to maybe to have some signs that may be friendly to use as a notice for people to know that they're entering into a safe space. So this is very important, and we can consider to have those kind of things first. For example, like the rainbow flags and the poster or announcement related events for the LGBTQ community, and as a resources for them to pay attention with. So this is something that I just want to mention as I come across with those questions. But sorry, I haven't had any experience yet, but I can always learn from you guys. Thank you.
Thank you so much for sharing. And it's so good to hear from you. So we're gonna move on. So this is a quote by Alicia Garza, who is co-founder of Black Lives Matter. So intersectionality asks us to examine the places where we are marginalized, but it also demands that we examine how and why those of us who are marginalized can in turn exercise marginalization over others. It demands that we do better by one another so that we can be more powerful together. And I think this quote is very important because even those of us who experience marginalization can be in positions of power to exercise marginalization over others. And we see it happen. And so it also is asking for us to, even if we do that are made invisible, it's really important to think about how can we make sure that even in positions of power that we maintain our ability to do for others and to speak up for others and to advocate for others. So what does allyship look like? And truly meaningful allyship, not passive allyship. What are you actually doing? What are you actually saying? So being inclusive, gender affirming language, inclusive environments, behaviors, and language create a safer community for gender nonconforming and trans people. Genuine inclusivity requires transformative change that can improve one's job satisfaction. So how are we making job places, policies, practices, procedures, how are we making it inclusive? Never, ever tolerate hate, stereotypes, or discrimination from anyone, whether it be in a workplace setting, school, or at home. Be the voice that leads to change. So whether there's someone who's LGBTQ in the room or not, we should never, ever let any kind of hate or discrimination go. It should always be addressed, whether someone who's LGBTQ is in the room or not. Counter hurtful comments with fact-based information, combat warped perceptions of social challenges in the LGBTQ community by brushing up on relevant research, share knowledge. Sharing your knowledge builds empathy and expands the network of allies. Never be gatekeeper of your knowledge. Always share it far, share it wide. Reduce instances of invading someone's sexual privacy. So, especially in working with clients who may be transgender or gender nonconforming, I mean, anything in general, but especially when it comes to trans and non-binary, sometimes people ask questions because they're nosy. And so it's really important to remember that that is causing harm. Ask the things that you need to know. Everything else is not your business. So it's important to remember that do not be nosy, do not ask personal questions that are not needed or that do not need to be known. Eliminate harmful perceptions of LGBTQ individuals. So eliminate your own harmful stereotypes or perceptions, and also work on educating others on eliminating their harmful perceptions. Ask pronouns in team meetings and interviews and on forms and documents. So making it a standard of asking everyone's pronouns, make it the norm in team meetings, interviews, on documentation, on forms. Yeah, it's important to normalize it in your culture and not pick and choose when to do that. Also having a bathroom that is all gender, all inclusive, especially if they're single stalled, there's no reason to make it male or female. Like, it just makes sense to have all gender bathroom in your workplace. So again, gender pronouns matter. Why do they matter? Because it is a sign of respect. Everyone deserves mutual respect. There is no reason to not respect someone's pronoun. If you have any questions or difficulty remembering, that is, you do the work. You practice, you challenge yourself to remember that person's pronoun. That is not up to that person to educate you. And if you need to practice, practice. But again, that is not that person's responsibility every day for a month to remind you of their pronoun. That is just ridiculous. So some key takeaways, just remembering to articulate your perspective respectfully and clearly, question your own perspective. Where is this coming from? Am I engaging in cultural humility? Demonstrate awareness of one's own biases. Am I seeking out support or guidance around processing my own personal biases, and how doing that and addressing that will make you a better social worker or therapist or practitioner. It's so important to always address our biases and stereotypes and then manage those personal biases and stereotypes. Personalize observations. So remember that just because one trans person's experience is this doesn't mean that all trans people's experiences is this. It's important to remember that each trans individual has a different lived experience. Not all trans people want to get surgery. Not every trans person wants to get surgery, and surgery doesn't define their transition. They define their transition. And so it's important to not ask those personal questions, because at the end of the day, unless it's something that you need to know for your work with this person, you don't need to know that. That's not your business. So remember to keep it professional at all times. And also, in general, it's always important to use I statements. When you're speaking about your experience with someone, always use how you feel and what you've experienced, not saying you did this, you did that, saying I feel this and I experienced this. And then continue to learn and stay informed. Again, we're always learning how we can do and be better. And thank you so much for sitting through the presentation. I hope that that was helpful. I hope you learned a lot. I have my personal email address just because next Wednesday will be my last day at Howard Brown Health. So I actually am putting my personal email address just because it wouldn't make sense to put my work address. So if you have any questions, feel free. And thank you so much. So we have one question. Is there a way to collect demographic information, including gender information, in a sensitive way? So I would say, so, well, I will say that I did a group for queer people of color at Howard Brown Health. And we didn't collect the demographic, but we did do a survey. And it was, we just kept it anonymous. But I do feel like there is a way of doing a survey and having kind of how a person identifies, and making sure that don't put your name, but like you can put your age or race or gender identity, however their pronouns, however they identify, as a way of collecting that data for the people you serve. I feel like that's one way to do it. I did it more so as surveying like their experiences in the group, but if you just want to collect data, I feel like that's one way of doing it. We have another question. If a LGBTQ group people felt shameful of their orientation, how can we help? So if someone feels ashamed of their LGBTQ identity, how can we help that person? So I would say showing them, one way is just being supportive and saying, listening to them, being there for them, supporting them in their identity. But also, there's so much good media. I know that there's some bad, but there's so much good media of LGBTQ people, interviews of just different LGBTQ people living their life and being authentically themselves. And I think that it's so, if you don't have any role models who are LGBTQ, adults that you can look up to who are LGBTQ, it's so important to have that visibility of being like, wow, like that person is happy and thriving. I can too. And to know that there's so much more than just right now. So I also recommend like showing people different like actors or actresses or YouTubers or different people who are LGBTQ and who are living authentically themselves, embracing it, and yeah, and just like showing them that there is a way to live authentically and live in your truth and be happy and live a healthy, happy life. Can you share where the 14 cultural humility practices? So you all have the slides, and the 14 cultural humility principle questions come from Michael. So the guy that did the graph. So it comes from him. And so the 14 cultural humility is just taken from the graph and then kind of laid out so that way you could see it better. But that comes from Michael Hogan, the one who did the black graph of working, being more culturally aware and working with different diverse populations. If I feel working with an LGBTQ client is beyond my scope of practice, is there a way to refer that client so they do not feel discriminated against, but they feel like I am trying to find the most skilled clinician? That 100% is okay. You should never feel like, oh, like I have to be everything for this client, because honestly, there are sometimes I've had clients where I don't have the capacity, and that's nothing against them. It's nothing against me. It's just that I don't have the capacity. So I think that you should definitely refer that person if you feel like you're not equipped to someone who will better meet their needs. And you could just frame it as, I just want you to get the most out of therapy or whatever it is. And I feel like I don't have the expertise or the skill or the knowledge set to give you the best that I want to give you. So this person, this clinician will maybe, they have a better skill set, they have more experience, more knowledge, more years in working with someone who identifies as LGBTQ. And there's nothing wrong with that. I think it's important. It's actually healthier to know our limits and to know what we know, what we don't know, what we need to work on. And that's okay to be honest with ourselves and our clients on that. That's what we should be doing. You can still grow and learn and improve your skill set, but also know that, hey, like this is someone who's better skilled in this, and I really want the best care for you. So this person would be better suited for you. And there's no shame in that at all, ever. Any last minute questions?
All right, Javon, I think you're getting a lot of thank yous. This is very helpful, wonderful information. So we really appreciate you taking the time and spending the morning with us. Very informative and helpful. Yeah, and everything, it just coming in. Thank you so much. Great information. A lot of thank yous. So again, have a wonderful day, everyone. And thank you, Javon.
Thank you. Take care, everyone.